In 1991, I was asked to join the board of what was then Water Street Rescue Mission, and it was for the intent, pretty much expressed intent, of seeing a clinic started at Water Street, primarily, of course, to minister to the residents of the mission. The residents of the mission, of course, oftentimes had limited access to health care. And access is not just do they have the money, which was an issue, or do they have health insurance, which was an issue, but also travel or transit to health care. There were issues of accessibility, and of course, a lot of the residents of the mission had significant health problems, including many who had health problems that resulted in them being homeless and being residents here. So we saw healthcare as being an integral part of ministering to the lives of the residents of the mission.
In today's society, there's a lot of maybe mistrust with the medical field, and so especially then when there's extra trauma involved, it's super important to be able to create a space where people can open up. If somebody comes into the clinic with a problem and it's not something that we usually handle, or it's going to require a little more resources, Dr. Mershon is willing to take those extra steps to make sure that we can address their needs and create some sort of restoration. There's just a safe space that he creates. He's also very good with taking that little extra time just to pray with our patients.
It really is rewarding to be able to minister to people who have so many needs, and to be able to make a difference, to be able to see changes in their lives, whether it's physical changes in the health clinic, or whether it's spiritual changes, emotional changes, breaking away from the various addictions or things that are controlling them. It's just really exciting to see the work that God does in lives here at the mission, and to be just a part of that.
There is more to our physical health than just the medical problems that are going on. And so seeing him tap into that and dig into what are some of the social things that are happening around us, and taking that extra time to really just get to the heart of some of the issues is super important.
The residents here are no different than us. We all have the same need for a Savior, the same need for reform and rejuvenation in our lives. So I think that's what I've learned the most.
Dr. Mershon does a great job of just acknowledging that we all are very broken. He'll pray with the staff before every clinic and just take that time just to get us into the right mindset of, like, we're not only serving these people from a medical standpoint, but we're trying to serve them from the kingdom standpoint. It's such a blessing to see how well our patients are taken care of. It's just a blessing for me as a staff nurse. Like, I get paid to do this, but we have so many people that just come and do this out of the goodness of their heart. And so just being able to see that consistency over the years with so many of our volunteers, and specifically with Dr. Mershon, is something I'm so grateful for.